Hello everyone. If you're watching this video, then you're probably preparing for the marriage and family therapy exam. So you're welcome. And I am praying that you will pass the exam and you won't have to come back and watch this video for another exam. So I'm gonna try to make this short, quick, and simple. This video is gonna cover a portion of Domain 5 for the marriage and family therapy exam. Domain 5 is the domain that covers managing crisis interventions. So they don't teach you this in school, but I found this tool, this assessment online called the SLAP assessment. It's SLAP, and it was developed by Kenneth Mars, and I'm gonna go into it in a few minutes and try to make it short and sweet. So SLAP. S stands for specificity. Whenever a client tells you that they're going to hurt themselves or hurt somebody else, they're suicidal or homicidal. That's a technical term. When they tell you that, then you want to make sure that you find out how specific the plan is. So for instance, if a client says, I am going to kill myself, and you ask them, how are you going to do it? And they say, I just think I can't do it anymore. I'm just gonna go take some pills. And you say, what pills are you gonna take? I don't know. Tylenol, something, I don't know. Just any pills, When they're not specific, there's, a likelihood that you may be able to put a safety plan in place without necessarily having to take them to the hospital to have them committed. So S stands for specificity. You want to find out how specific is the plan. The next one is L. L stands for lethality. You want to find out how lethal the plan is. Lethal. So, if, for instance, the client says, oh yeah, I hate life, life sucks, I want to kill myself. And you ask them, well, how are you going to take yourself out? And they say, well, I'm just going to bury my head in a bucket of cold water. Now you know that that's not going to kill anybody. Well, most people will not be killed by that, okay? You may just get water in your nose, ears, eyes, whatever. But that's not enough to kill you. So, you want to, if the client's plan is not as lethal, then there's a possibility that you can be able to put a safety plan in place and they'll still be safe. However, if they tell you that they are going to get a gun and blow their brains off, now you know that when they do that, the chances that they're going to survive is very slim. Don't try to put a safety plan in place. All right. The next one is A. A stands for availability. Okay? You want to find out how available is this tool or this plan that they have. How available is it to them? So for instance, the same person who says, I'm gonna blow my brains out, and you're like, oh my god, this is lethal, it's gonna kill you, right? I mean, you don't tell them that, you're thinking, this is lethal, it's gonna really kill this client. I want to find out, do you have a gun? And they're like, no. Well, how are you gonna get one? Well, I can find one. The weapon is not available. Does your mama have a gun? No. Does your mama have a gun? No. Does your daddy have a gun? No. Does your daddy's brother have a gun? No. Okay, so then you're a little bit relieved too. A weapon that they want to use to carry out the threat or whatever is not available to them. So at this point, you still, you might still be able to put a safety plan in place, not necessarily having to commit them to the hospital. Are you still awake? I think so. All right. So S stands for specificity. L stands for lethality. A stands for accessibility or availability of the weapon. And P stands for proximity to resources for help. So for instance, if they give you a plan and they say, I'm gonna overdose, okay, on my pills. And which is, by the way, this is also a good example for availability, where if they say they're going to overdose on medications and they don't have any medications in the house to overdose on, then there are chances that you can put a plan in place and they will be safe, right? Okay, so back to proximity. So the client says, well, I'm going to overdose on whatever it is, Seroquel or Xanax or whatever it is that they've been prescribed, or and then and they say, when you ask them, well, when are you gonna do it? And they say, well, on Sunday mornings at about 9 o'clock, everybody would have gone to church by then. I'm just gonna fake and say, I'm feeling sick and stay back home. And when everybody's gone, I'm gonna take the pills. Now that when if that were to happen, the chances that somebody will be close by to offer support to that client is very slim. So at that point, you don't want to try to put you may think about putting a plan or whatever, but it may be wiser to have them go to the hospital or committed to a place where they can be watched, right? Because you don't, if a client has a plan that they're very specific about, it's gonna be lethal. They have access to that weapon, or the method of delivery, whatever, and the proximity to help is far away. Then you want to make sure you're acting fast. You don't want to leave it up to chance and say, oh, you're gonna change your mind. No. You want to make sure that you're having them either committed to the hospital or putting a family member there to take away some of those choices that they have to them. More than likely, it's going to be better to have them committed to the hospital. I think I covered everything. So it's SLAP. Now, just to let you know, on the MFT exam, the chances that they will ask you, what does L stand for in the SLAP assessment? That's not going to happen. They're not going to ask you that. However, your understanding of the SLAP assessment will help you to answer the questions under crisis intervention better. So for instance, if they ask a question about, maybe somebody threatening to hurt themselves or whatever, and one of the options has to do with maybe do they have family members around, or do they have friends around? Okay, your knowledge of the SLAP assessment will help you to put things into perspective. You will not say, oh, maybe the very first, if they ask you a question like, a client tells you that they are suicidal and they have a plan, what will be your next best step as a therapist? You will not immediately say, maybe dial 911 and get a client committed to the hospital. There may be other options there that's related to SLAP that may be the next best option before you eventually take the client to the hospital. You want to make sure that you're assessing the client well before you just immediately taking them to the hospital, because you remember that once you pick up that phone and call and say, I have a client here that's trying to kill themselves, you are breaking confidentiality. So you always want to make sure that you can absolutely justify the need to break confidentiality before you do so. So I'm gonna see you in the next video. All the best. God bless you and pass that exam. This is MFT Exam Smasher signing out. Bye-bye.